towards social media in the Technopod for session. So I'll be talking about Instagram, the newer social media app which is into vogue past few years, and how does this help to maximize our practice. So last year there came a series called Social Dilemma on the Netflix, and it was a very, one of the hit series which people watched during the pandemic. And there were two types of reaction to this series. Some people went in denial, many people deleted their social networks or the social apps which they had. And similarly, recently with the WhatsApp privacy, we again did the same thing, like jumping onto Signal or Telegram and other things. So this is like the two different reactions we always have when it comes to social networking. And coming to Instagram, so very recently Instagram was a separate platform before some months when Facebook took it over, and now it's connected with Facebook. So now there's a small heading down there that it's Instagram from Facebook. And of course there are many people who have moved away from Facebook or don't want to use Facebook. They were using Instagram for a while, and now the Facebook has actually followed there. But there are ways you can log into Instagram without using a Facebook as well. So why there is a transition to Instagram? So I went through some statistics I came across through some doctors' accounts across the world, and the doctors who had highest followers and how they had built their practice using Instagram, particularly in the US. And then if there was such a large population which was on Instagram, the younger generation population which was on Instagram, so why not make use of this, and why not target this social app, and why not the doctors use it? So one is, it has a very good interface as compared to the other apps, I would say the social media apps. The profile looks very concise and it's very to the point. It's like wonderful, and it looks like just an album of pictures similar to what a Pinterest would look like, which is again one type of app we follow. So I'll take you through 10 points about Instagram and how is it going to help us to improve our practice. The first one is how to make a profile, and why the profile, we should have two profiles, that is a professional profile and a personal profile. So we just discussed this before, that we need to hide some of our personal things or personal identity. Neeraj also emphasized that we don't need to have a display picture at times. So it's good to have one professional profile all the time, which is open to the public. So the personal profile can be closed, where only your family and friends can access you, where you can have your personal pictures. Of course, you can have an information where people can follow you on your open account or the professional account. So the profile which I said is a very concise looking profile, and we can of course write what we do or what we are. So like I mentioned that I'm a pediatric orthosurgeon and you have to follow me on this. That means I'm not going to accept request on the personal account. It's clear. Second is, if somebody wants some work with me through my NGO, it's clearly written that I have an NGO account and you got to follow me here. So that's how people can easily do that. And it's very easy to switch from one single device to 3 different accounts. So just down in the corner, if we tap at the downside left side corner, it's easy to quickly switch between all the pages or accounts which we have. And I would insist that all the doctors, if you want to have a professional page, you could have your hospital page or your individual page or an individual handle as we call it, and just use it for professional purpose and do not post any of your personal pics over there. Second is, why do we need to have it? So by just having a good social media app, we can connect with people, and of course we can also showcase our work on this. So simple posts, like when we connect with colleagues, we can post there, and that's how we expand in their network. So when you tag, if I take a picture with 3 physiotherapists and they post me, I get further more networking in a physiotherapy group which goes through their accounts, and that's how we expand our networking. Similarly, we can showcase all the activities which we do, small conferences, meetings for patients or doctors or family forums, or larger conferences where we meet and we can tag people and have people connecting with us through this forum. Second is, through this we can also connect with the patients, and quick pictures of visits in the clinic can always be posted, and many a times the patients like to follow us, and they are very happy to be linked to our account or like or comment, or they would like to also post. So important is when we post these pictures, what captions we put and what are the hashtags we put. And this is the most important part of Instagram. I mean, everything else is like, everyone would think that why to have all this, but I'll come to this point later. And like I said, many a times the patients want to share a lot of things with us. Like I have patients who want to share a cake, a gift, a card. Of course, it's a benefit of being in a pediatric field, unlike a field, a geriatric, where people are quite complaining at times. But in a pediatric field, if you see, the child never complains. The child is always playing around. He's least bothered about the crooked limb or anything. It's only the parents who are bothered. So I think it's a very nice advantage of being in a pediatric field. And most of the times we can also repost what the patients post. So usually the patients post and they tag, and I can repost it back. And that's how it's to connect with the patients as well. And it's important to respond to them back. So now looking at this past 2 slides, you would think that what a big deal. Facebook does all of this, and why would I need another app or another social media in that case? And there it comes that it is all this time we are just, there is an echo, guys. So now all this time what I have shown is like creating the content. So it's basically creating a content to connect with the colleagues, to connect with the patients. But all this content we are going to use, and how we are going to make use to use it, maximize our practice. And there comes the big thing, hashtag. So hashtags came when we came up with Instagram. And how do we get the best hashtag and what does it mean? So when if suppose I write my name and I want to Google it, so apart from 1 or 2 hospitals which I'm attached to, the second thing which comes up is Instagram. Why it comes up? Because all my posts have been hashtagged as doctor, and this is the hashtag which has helped it to come up right at the top. So that's how it is like one of the most important form of SEO. So we pay nearly, most of the doctors or clinic owners might be paying nearly $1 lakh or more for a search, like for an SEO. And how do we create those keywords for the SEO? And how maintaining that SEO over the year and every time renewing the SEO puts us into so much of a money to lose actually. And by just going through this basic hashtag of your own name, which you can revise, you can have as many keywords as possible, you can have newer keywords as possible, keywords related to your surgery, keywords related to diagnosis. Anyone who types that word on a Google, this works as an amazing search engine optimization. And I think that is where Instagram beats the other apps, and that's how people get to quickly find you or quickly find the right word which they are looking for. So I'll show you this one. So this was one of the patient with whom I posted this picture, and we put up all these hashtags. So next time anyone is looking for someone to be treated for a birth brachial plexus palsy, or how to take care of a shoulder spica, how to do a shoulder muscle transfer, or a pediatric ortho, I'm the one who's going to get popped up first. So on the Google. So that's how it works like an SEO, and that's how it works very nicely other than compared to other apps. So I think the main highlight is doing the best hashtags, and there are various apps which help us to find the best hashtag even in the healthcare field. And we had a very nice similar session with Ortho TV where they had professionally explained us about how to do this best for doctors. So we had a very famous hashtag during the lockdown by our very favorite Dr. Abhay Nene sir, and he had this hashtag lockdown like docs, and that went very popular even in the media. Fifth is feedback. So we don't have control over the Google feedbacks. So there might be people who are little not happy with the visit in the clinic, and they might put something weird thing. Now, 2-3 people had put something about me, she doesn't see patients beyond 18 years of age or adults. Of course I don't see, I'm a pediatric ortho, but that keeps on popping up all the time. So best is I pick up my own best feedback, put it as a patient review or a hashtag feedback and put it up there. Anytime next anyone wants to search a review about me, they're going to write a name, a review or a feedback, and these are the things which are going to pop up. So I have a total control, not based on Google, not based on Just Dial, or any of the things which we can't take down, but things which we have a total control and just show them up there. The other thing is, number 6 is networking. And by simple little hashtags, so we had a session on women in orthopedics and I did one of the hashtags and I was like kind of connected with another big women's group from Mexico and then some other countries. And that's how it also helps us to expand our network, communicate about the various activities we are performing, also create awareness or give away information. So not only just branding or marketing ourselves, we can also help in providing awareness for patients and it works like an additional tool in our benefit. And the newer thing in the Instagram part is the IGTV. So IGTV works like a YouTube channel where you can record small videos and you can upload it. So the Instagram page looks like this. These are the pictures and this is the IGTV part. And we can have small case files or pre and post-op videos of patients. And this is very much in vogue. After TikTok stopped, IGTV like built up like very fast. And before that, I used to have very few views on my IGTV and you suddenly see there is a lot of view on that. So this became again a much more better thing and I think it's a very good way of connecting videos which we put on YouTube. You can instead have them on your Instagram and they come on one page. Not only that, we can share this post to other platforms directly from here, maybe Twitter, Tumblr, or Facebook if somebody is using. And it's very easy to do that in case if you want to still stick around with Facebook. And the last thing is don'ts. They follow the basic things. Don'ts is we don't have to follow for fake followers or the scam of followers. You'll be approached by many people where they would want you to have thousands of followers. This is one of a very legit account and this doctor has 3.9 million followers. He's a guy from US and they are the real-time followers and that's how I think we should not fall for the fake follower thing because it is actually not the right thing. Second is it is not just about marketing or branding ourselves. So having posts which are like too much of a marketing stuff just don't look good on Instagram. We need to make it a little real and connect with the people who are there with us. Preferably have a lot of activities, links sent to patients so that they connect with us on this app and that's how we can have more of followers who really mean to us. Then another thing is promote your posts. So this is kind of a paid promotion here and I would strictly say that doctors should totally avoid this and stay away from this kind of promotion. We don't need this, we just have to be connected with our colleagues and our patient and that itself works for it. We always need to hide patient identity, take a quick consent from them before posting anything on the social media or any sort of personal pictures of them. And I think if all of this is followed, we can certainly remain out of trouble. Sensitive content, all the pictures which have blood or surgeries are actually taken down from Instagram. So there is an option to just label it as sensitive content. And people who don't want to see, they actually don't see and Instagram doesn't take it down. So in case we want to put up intra-op pictures, it is allowed, but it should be labeled as a sensitive content. And when somebody clicks it, then we can have a bigger picture of it. To summarize, I would say that Instagram is like a big package, a package which helps you combine many apps. So instead of having too many apps, we could have one app which is Insta. So I would say a Pinterest which works like a photo album, a Facebook or Pinterest both work like similar way. A YouTube, similarly we could have an IGTV on Instagram. A meeting platform is an Insta Live. So Insta Live is like where 2 or 3 people can join and have a meeting. They can discuss things. And during the lockdown, I have had many family forums on Insta Live and they were really very nice. We had parents who had joined us on many of the Insta Live programs and it was really wonderful. And similarly, the app which is now no more with us, TikTok, that is the Reels. So Instagram gives us all of this together and I think it's a very good app and it is just time to upgrade. So like when we were a little younger, we used to use Orkut, then we moved to Facebook and then the newer one, Insta. So it's not that the other apps are outdated, it's just time to upgrade like we upgrade all other apps from the App Store or Apple Store. And using the right hashtags is going to make a lot of difference in the practice. Thank you.